This is Christian Gomez with the New American Magazine, and back on the show with us is Dr. William Lile, also known as the ProLifeDoc, who has a channel on YouTube as well and has delivered how many babies again?
Just under 4,000.
4,000 babies. Welcome to the show. We're glad to have you on today.
Thank you. It's a privilege to be on again.
So there was an article that was recently published in the Journal of Obstetricians and Gynecology, was it? In December of 2019, that the point of the article is to try to disprove what you talked about in our previous interview with regards to abortion reversal, that abortion reversal doesn't quite work. Can you tell us a little bit about this article?
Well, 39% of all abortions now in the United States are performed with a pill called RU46. And this is very different from the morning after pill. The morning after pill was indicated for 72 hours after intercourse. The abortion pill RU46 is indicated for 70 days after the first day of the last menstrual period. So fully a baby that is 10 weeks along. In the trials, the RU46 protocol was found to be 98% effective. Well, we all make decisions and we all have regrets from different decisions. And we know that there are patients who will walk into an abortion clinic saying, this is the only option for me. Nobody loves me. Nobody cares for me. The world will be better without this baby. They take the abortion pill and they walk out and they have immediate regrets. So for a few years now, we've been doing research and we've been running trials looking to see if we can reverse the effects of this abortion medication. This trial was set out to prove, that was their goal, was to say abortion pill reversal is not possible. And the media just took a couple of sentences and they said, well, the trial was stopped because of severe hemorrhage in some of the patients, and also because some of them needed to have surgery and blood transfusions.
So the media was trying to correlate the cause of the hemorrhaging and severe bleeding to the abortion reversal procedure?
Correct. And it was not the abortion reversal arm of the trial that had the problems. There were 10 people, only 10, that were enrolled in this trial. All of them were pregnant in the first trimester. All were planning on getting a surgical abortion. They were counseled and they enrolled in this trial. Half of those patients received, after they got the RU46, the abortion pill, half of them got placebo. The other half also got the same abortion pill, but they got a dose of progesterone, the medicine that we truly feel, and which makes sense, can reverse the effects of the RU46. When you have these 10 patients, the number of patients in the first arm, the one that just got placebo, 2 of those patients after 2 weeks had heartbeat still. So 2 of the 5 still had a heartbeat. In the arm that got the progesterone, 4 of those patients out of 5, so 80% of those patients still had heartbeats. But then the news media said, but the trial was stopped because they were patients that had to have D&Cs, they had to have a surgery, and some of them even had to have blood transfusions. Yes. Who were those patients? Well, 2 patients had to go to the hospital and get D&Cs. They had to have surgery because of heavy bleeding. Both of those patients were in the placebo arm, not in the reversal arm, the placebo arm. There was also, of those 2 that had to get surgery, one of those needed to actually get a blood transfusion. Well, which arm was that patient on? Same thing. They were in the placebo arm. So when the media will say this is an abortion pill reversal trial that was stopped because of the need for surgery or blood transfusions, yes, but all those patients got were the abortion pill and the placebo. In the arm that actually was getting the reversal medication, there were no surgeries and there were no blood transfusions in that group.
It's very deceptive of the media. Of course, you're not stating that the placebo was the cause, of course, of the hemorrhaging and severe bleeding. Rather, the cause would have been the abortion pill, the RU46, that caused that, right?
Correct. In the original trial when this medication was approved,
The RU486, you mean?
The RU46, they anticipated that 0.6% of patients would have heavy enough bleeding to take them to the hospital. So less than 1%. Even the authors questioned that, and they said, it was supposed to be less than 1%. We had 25%. And the ones that had to get surgery and blood transfusions, all they got was the RU46, the actual abortion pill, and the placebo. And the placebo did not cause them to have hemorrhaging, requiring them to have surgery and a blood transfusion.
So rather than try to disprove that progesterone, the abortion reversal, actually works, and instead of disproving that, what they ended up doing in this trial that was published in the December journal was bring up questions about the fact that the abortion pill itself can cause severe bleeding when earlier studies said only less than 1% could suffer such consequences, right?
Correct. It comes down to letting patients know accurately informed consent. What are the true risks and alternatives, and what can I expect with this medication? And that's a big difference between anticipating less than 1% and experiencing 25%.
Now, there was another article that was published in a more recent journal in January with regards to the long-term effects of women who have had a miscarriage, not by their choice, of course, obviously, and ectopic pregnancies, and how that causes long-term traumatic stress disorder. Can you tell us a little bit about that article and how that relates to the pro-life issue and abortion?
Absolutely. What the trial looked at, it looked at over 650 women who, in the first trimester, had either a miscarriage or they had had an ectopic pregnancy. But then they followed them psychologically. Mental health is a huge women's and men's health issue. And what they found was they looked for signs and symptoms and meeting criteria of PTSD, moderate and severe depression. And what they found was 1 month after a patient either had a miscarriage or an ectopic pregnancy, 29% of those patients were experiencing either PTSD or moderate or severe depression.
And for those watching, can you just briefly explain what an ectopic pregnancy is?
Sure. Ectopic pregnancy is when, yes, there's a pregnancy, but it didn't occur in the lining of the uterus where a pregnancy should occur. It occurred usually in the fallopian tube. Sometimes it can be in the cervix. It can even actually be up in what's called the corneal area of the uterus. It can be on an ovary. It can be on the bowel. Ectopic just means other than where it's supposed to be. There is no way to save a pregnancy that is an ectopic pregnancy. We are either going to lose the life of the mom and the baby, or we can save just the life of the mom. So either way, you're not going to be able to get a healthy baby when you have an ectopic pregnancy or when you have a spontaneous miscarriage. Once it's diagnosed, it needs to be treated. There are a couple different ways to treat an ectopic pregnancy. One is surgically, where you will surgically go in and remove, say, the pregnancy from the tube. We can actually open up the tube with a laparoscope. We can remove the pregnancy and then allow the tube to safely heal itself. And then the majority of the time, we can actually get another pregnancy that forms through that tube and the pregnancy can come into the uterus. So, but we have to remove that pregnancy. The other way that some people will stop that pregnancy's growth is by using a chemotherapy called methotrexate. Ruptured ectopic pregnancy is still the #1 cause of death in women in the first trimester. It's one of the first things that we always look for when somebody has a positive pregnancy test. It's like, yes, you are pregnant, but where is that pregnancy? But the bottom line with this article is that even though it was the first trimester, moms had anticipation and they had a bonding that occurred with this pregnancy, even though it was a miscarriage and they lost. My wife and I had 4 miscarriages, 2 perfectly normal kids. And it's not just like having another menstrual cycle. Oh, get over it. You'll try again next month. No, you see a baby's heart beating on the inside like we did. And then you have this anticipation. You know this is a new life. This is your baby on the inside. And then you would see a month later, 29% had real mental health issues. And 9 months later, 18% still had, 1 out of 6 still had either PTSD or moderate or severe depression. So there is a bonding that goes on between a mom and this baby that's growing on the inside. And what it makes me think is, well, we know that people have regrets when they take the RU46. We've now successfully reversed over 1,000 abortions that were initiated with RU46. I've initiated and successfully reversed 6 myself. So people do have regrets. So if we have PTSD, depression, and anxiety when somebody has a miscarriage, what are the mental health issues that women experience after it was their decision to take the life of their baby.
Absolutely. And of course, you were also recently at the March for Life rally in Washington,
Yes.
D.C. How did that go? And what sort of context did you make while you were there meeting with others in the pro-life movement?
Sure. I got to hang out with 500,000 of my closest friends. It was amazing. There were people from all walks of life, and even though you weren't expecting to bump into anybody you knew, we easily bumped into 25 people that we didn't know were going to be there. We just bumped into there amongst 500,000 people. One of the most encouraging things for me was to see the youth that were involved. Easily 50, 60% of the people that were there and were involved were under the age of 25. It could have been even higher. There were busloads of kids. They were in huge groups. They were from churches and from schools and just different groups like Students for Life that had just spontaneously shown up. Having the president speak was amazing, but just feeling the solidarity between like-minded people. It was very well behaved. There was not trash that was left. When we were in lines waiting to go through security, through the Secret Service, I would turn around and face the crowd and we would educate them on how we treat preborn as patients. We have video of hundreds of people just wanting to know more about how we can do a blood transfusion at 18 weeks, how we can do heart surgery and neurosurgery, spine surgery at 22 weeks gestation, how we treat the preborn as patients while they're still in the womb. We answered as many questions as we could. We talked about abortion pill reversal. It was just a great opportunity to educate, but then to be unified in saving the lives of the preborn.
Amen. Well, thank you so much for being with us on the show, and we're glad that you were able to go to the March for Life and that it was so well received to be there. So, of course, thank you for joining us on the program again. Take care, and God bless you, Doctor.